Welcome to UK Healthcare. I'm here at our hospital. We're really excited to have you here today. I'm going to be showing you how I do an IV on a patient, but we're just kind of hanging out at the nurse's station right now. I'm just going to check the chart and make sure that order is in there from the doctor, like what he wants me to do, and make sure that there's an order for that. Our hospital has a lot of protocols in place for certain procedures, so I've been taught how to do an IV based off of UK Healthcare's protocols, so we're going to go ahead down there and do that right now. If you have any questions, just let me know. We're going to head to our patient's room. Okay. So this is our patient's room. We're going to see Mr. Jones. Mr. Jones is a 50-year-old male, and he's experiencing some dehydration because it's been such a hot day. He just hasn't had a lot of water. So I'm going to knock before I enter, just to let him know that I'm coming in, in case he's doing anything or needs some privacy.
Come in.
Okay, Mr. Jones gave me the go-ahead, so let's go ahead and head on in this room. Hey, Mr. Jones, how are you today? My name's Ann. I'm going to be your nurse taking care of you during this shift. So I'm here until about 7 p.m. tonight. So here's your call bell.
Why do you have to give him a call bell?
The call bell is to ensure that he has a way to get in touch with the nurses in case something happens or if he's like experiencing some sort of symptoms, or just to call out if he needs to go to the bathroom or do anything that he can't do on his own. The hospital room is set up with all the equipment that we would need for any sort of patient. We have a sink to wash our hands, we have hand sanitizer, a trash can, some paper towels. We have oxygen section, and we have some different assessment tools up here as well as our sharps container. Okay, so we're here in the supply room. We just have to grab a few things for the procedure. So I know where everything is. I'm just gonna grab everything that we need. So we are here in our patient's room. We have our patient right here. It's Mr. Jeffries. We're gonna be starting an IV on him to gain IV access.
Why are you gaining IV access?
I need to gain IV access because Mr. Jeffries is dehydrated and we need to get some fluids running on him. So I have all my supplies here. I have our needle or our catheter.
Why do you need that?
This is what we use to get into the patient's veins so that we can deliver the medication or the fluids. So that is our port of entry. The needle doesn't stay in there, it comes out and it leaves like a kind of like a straw, like a plastic straw. And this is our extension set.
What does that do?
This connects to the hub of the IV because if you later when we look, it's very short once you get the needle in there, so you need something that's a little bit longer so that it doesn't tug at it as much. And we're going to secure that next to the IV so it doesn't tug the IV out at any point. I have my tape, some alcohol preps, gloves because this is like a clean procedure so we don't want to give the patient an infection. I have a saline, sterile saline prep.
Why?
This is to flush the IV. So when I get the IV access, I'm going to pull back to make sure I'm in a vein and I should see blood. And then I'm going to flush it back into the patient. And it's called a saline lock when you attach the saline to this extension set. And that just keeps anything like medication out of there. You want to kind of push anything that was in there through. So that's what we're doing with this. I have a tegaderm. This is what secures the IV in place, and we can write our date on there for when we establish the IV access.
Why do you need the date on there?
So that you can change it when it needs to be changed. The date is on there so that you can change it weekly, and just to let the other nurses know when it was established because you don't want to take out a fresh IV if it was just put in there. And then this is an IV start kit. I mostly have everything that's in here out on my table right now, but just in case I need any extra supplies, they're in here. First, I'm going to wash my hands or apply some hand sanitizer.
Why do you do that?
This is because this is a clean procedure. It's aseptic technique. We don't want to get any sort of germs on the patient or in the patient's bloodstream. First, I'm going to put my hair back. This is so it doesn't get like anywhere in the procedural area. Don't want it touching the patient or dangling anywhere where it's not supposed to be. I'm going to wash my hands because I just touched my hair and I've been touching all the supplies. And we wash our hands before we put on gloves just for clean technique so that the patient doesn't get any sort of infection. Alright, so
Why are you putting gloves on if you just wash your hands?
this is like a double barrier. So we wash our hands in case the glove breaks. We don't want anything like under the glove. Like it wouldn't be good to put a dirty hand in a glove and then have the glove break during a procedure because then you're going to infect the patient. So we just want like to really take some good precautions to limit the spread of infection in our patients. Now that I have my gloves on, I'm going to open up everything. All of these packages are clean or sterile, so we don't want to compromise the integrity of them. So this is our IV extension set that I was talking about earlier. We're going to go ahead and connect our saline to it.
Why do you connect it before?
Just because it saves you a lot of time in the long run, and it's not as much of a hassle when you once you establish your IV access. Okay, so we're going to take this and set it out here by the patient. The ends are covered so that there's no infection that's going to be a threat to our patient. Okay, now I'm going to open my catheter and have that ready for when I find a vein in the patient that I'm wanting to use. I'm going to set that aside. Alright, I'm going to go ahead and get this tegaderm out. We'll deal with this a little bit later. Place our tegaderm there.
Why are you placing everything on the field?
I want to have it nearby, so it's not a sterile procedure, so we don't have any sort of sterile field, but I do want to have my materials nearby so that I can easily access them. So I'm also going to grab some tape and use this as my some securement for the IV once I get it in. We really like to make sure that it's secured, so we use tape and the tegaderm to keep it in place. The tegaderm is mostly to keep kind of bacteria or germs out. I get that ready on the side of my table, come to my patient. Hello, Mr. What did I call him? Hi, Mr. Jones. We're here to start an IV access on you. I'm going to ask Mr. Jones for his permission. He is going to grant it to me, hopefully.
Why do you have to ask for permission?
You have to ask for permission because it is like the patient's choice, and they have an integral role in their healthcare. They get to make their own choices and decide what they want and what's in the best interest for them based off of the information that we give them. So I've let Mr. Jones know that if we don't establish IV access, he could lose consciousness because he's really dehydrated and needs some fluids to help out in his bloodstream. So Mr. Jones has granted me access. I've checked his date of birth, I've checked his name and his medical records number.
Why do you have to check all that stuff?
We check that to make sure that it's the right patient and that we're not doing this on a patient who doesn't need it. So Mr. Jones does need it. He has granted me access. He has no allergies to the saline or any of the latex that I'm using in this procedure, so we're all set. All right, Mr. Jones, I'm just gonna look for a vein. So I look around once I have the tourniquet nice and tight on here. I see this nice vein right here. It's really bouncy. Once the tourniquet's on, it kind of cuts off the bloodstream so these veins get nice and puffy and I can feel where it is. So this one's really prominent. It's really bouncy when I touch it. So I've decided that I'm going to use this one. So I'm going to get some alcohol prep out and I'm going to thoroughly scrub.
Why do you need the alcohol prep?
This is to disinfect the patient's skin. There is like bacteria that just sits on our skin, on everybody's skin at any time. So by disinfecting this area, I'm limiting the risk of infection in Mr. Jones. So we like to scrub it for at least 15 seconds, get it nice and clean. Now that that's done, I'll let that dry for a second while I bring everything closer and ready.
Why do you have to let it dry?
So I'm gonna let it dry for a second, just so the alcohol doesn't get directly into the skin because that could sting and be uncomfortable for the patient. So I'm leaving the tourniquet on. I'm going to uncap the IV. This is a 22 gauge
Why are you using a 22?
IV catheter. We're using a 22 because we don't anticipate Mr. Jones receiving any blood products while he's here. His blood count is good. He's just very dehydrated, and 22 gauge is the best for just delivering IV fluids. So I'm going to pull back on Mr. Jones' skin.
Why do you pull back?
This just kind of makes the vein taut, and it kind of ensures that it's not going to roll anywhere. So I'm just kind of holding down on it and pulling a little bit with my thumb. So we go at like a 45-degree angle into the vein. You kind of feel it pop once you get in there. So if this was a real patient, I would pull back to see if any blood comes, but this is not a real patient, so we're going to go ahead and advance the catheter and click to get the needle out, and then you hold pressure above the site so blood doesn't come out. So if this were a real patient, blood would start dripping out of here, and that's why you want to have everything ready, at the ready and available to use. So we're gonna pull this cap off of our saline extension set that we established earlier. And this is a lower lock system, so you just kind of push and then twist till it's secure. So now that this is established, just to really ensure that we're in the right place, I'm gonna pull back to which I would see blood coming up this tubing set if I was in the vein. If I wasn't in the vein, nothing would come up. The patient lets me know that it feels good. I go ahead and push that back in there, and I'm just gonna keep pushing all of this saline into the bloodstream. Now comes the fun part where we get to secure it.
Why do you have to secure it?
So the catheter is very flimsy, and if we don't secure it, it could come out of the patient at any time. So we go under and then over on the wings of the catheter. So this is one of the really good ways to secure it because it kind of holds it down, and then the last step is to put a piece right over top of the catheter. Okay. So once we have that on there, we can go to place our Tegaderm on here. I'm gonna flush the rest of this so I can just kind of get this out of the way.
Why do you need the Tegaderm if you already have the tape?
The Tegaderm keeps all of the infection out. So it kind of makes sure that any sweat or germs or anything that's coming down Mr. Jones' arm doesn't get onto our site. Because if you can come closer here, that is the portal of entry in the skin. So there's potential for any sort of bacteria or germs to come right in that area. So the Tegaderm kind of protects the whole site and just adds another layer of essentially tape to hold it down. So you just place it and make sure that it's nice and snug right over the portal of entry and press it down good. So now we can take this part off, which kind of just helps us get it down there without sticking to us. Here's where you would write the date and sign your initials to state that you were the nurse that started the IV. So you put that on the Tegaderm, it's kind of a nice another layer of protection for the patient, just the nice securement device right there. So the next step is to lock this, and that's kind of why it's called a saline lock. We've got saline in here. We're gonna lock it up, and then we're gonna secure this to the patient. And this is again so it doesn't tug anywhere. Tourniquet can come off.
Why can the tourniquet come off?
The tourniquet can come off because we have established the access. It really can come off once the IV is in the vein, because that's the only way that you're going to be able to push your fluids through is without the tourniquet. And tape down our extension set right next to the IV. So now I can collect all the materials I used, get all my trash up. Don't want to leave any sort of plastic or anything laying in the bed because that could just maybe harm the patient or make them more uncomfortable. This needle is going to go in this biohazard box right here.
Why?
This is the sharps container, so any sort of needle or any sharp object that comes in contact with the patient or might be contaminated with their blood or any other bodily fluids can go in the sharps container, and that is taken and incinerated because we don't want the risk of anybody poking themselves or getting infected by something if it's just in a regular trash can, because somebody could reach down to change the trash bag and get poked by something. Yeah, I also put syringes in here because a patient, of course not Mr. Jones, but a patient could potentially steal that and use it for anything that they might not or should not be using it for. So I'm going to wash my hands again.
Why do you have to wash your hands again?
Because I just took my gloves off and I'm getting ready to touch the patient. And I just want nice clean hands. I'm gonna readjust Mr. Jones on his bed and get this tourniquet out of the way, clean up his bedside table. I'm gonna ask Mr. Jones if there's anything else he needs before I leave his room. Mr. Jones will say no, because he's a great patient. And I'm just gonna let him know that I'll be back to check on his IV site in a little while and start his fluids.
Why do you have to let him know?
Just gonna let him know I'll be back so that Mr. Jones and I can establish some trust, and so that he will kind of be on the lookout for me. If he has any questions, he can start thinking of them, and I'll be back to take care of his IV in a little while and give him some fluids to get him on the road to recovery.